Now we're ready to look at the solid organs on this study. So what we're going to do actually is we're going to go back to our 2.5 millimeter slices, and we're going to put it on the abdominal window, which is what we have here. And then we're going to come over to our coronal and put it on the abdominal window as well too. And we'll kind of orient ourselves kind of in the center on the coronal, just so we can kind of tell where we are. We'll start at the top of the scan, and when we're doing this part of the search pattern, I like to start with the heart and the mediastinum here, and we can scroll down and just take a look at the heart and kind of appreciate what's going on. So when we look at the heart, we have our right ventricle right here, right atrium, left ventricle, you can see that it's thicker walled, and then we have our left atrium here as well too. So we can always take a look at the heart, just make sure that there's no cardiomegaly, that the ventricle and atrial sizes are okay. Make sure there's no pericardial effusion, fluid around the heart. And as we look at the mediastinum, we don't get the best view, but we can look for mediastinal lymphadenopathy. Now, after we finish looking at the heart, we can very smoothly transition to the liver over here. And then we can kind of go up and down and just look through the liver parenchyma for any, lesions, any abnormalities. But this liver is looking pretty good. But this is our liver here. And again, always you can go and look on the other views as well too to help orient yourselves. Once you're done looking at the liver parenchyma, you'll just want to find the gallbladder, which is right here. And you can look at the gallbladder and just make sure there's no pathology there. And then you can follow, this is the common bile duct. So right around the area of the gallbladder, you can follow that down. We kind of lose it here a little bit, but you can follow it down to the pancreas, which actually we see right here. It does have kind of a unique parenchymal texture to it, the pancreas. So you can go back and forth and just make sure there's no pancreatic ductal dilation or abnormalities. Make sure there's no inflammation around the pancreas. And as you kind of go, you can make your way over to the spleen, because the pancreatic tail will point towards the spleen. And now we can take a look at the spleen here. Just make sure that the spleen looks okay, just going up and down. And then very smoothly from the spleen, what we can do is transition to the left kidney, which we see right here. And then as we kind of scan through the kidney, you can actually also catch the adrenal gland right here. This is the left adrenal gland. And then you can come over to the other side, look at the right adrenal gland, and then take a look at the right kidney over here. Now, at this point, I think it's really helpful to have your coronal view, especially if you're having trouble finding the adrenals, or really in general, it's actually pretty useful to look at the kidneys in a different view as well too, because sometimes there can be pathology that you can't appreciate on the axials. So I think at this point, it's really helpful having the coronal, so you can look at the kidney, just looking at the right, looking at the left. For example, there's a little hypodensity here. Maybe we didn't see that on the axial. It's not of any clinical significance, but you may be able to catch things that are significant. And then also, sometimes it's hard to find the adrenals, but you can kind of see them a little bit more clearly on other views sometimes. At this point, when we're looking here too, we see something. This might be an adrenal nodule, it might be a lymph node, but it's something that we're catching here that we can investigate on a little bit later. But in terms of our search pattern, we're able to appreciate unique pathology based on using our coronal images. Now that you've looked at the, these are pretty much all the major organs that sit in the larger, in the superior aspect of the abdomen, what you can do, and what I like to do, is find the ureter. So there's the right ureter right here, and we can follow this ureter down. There it is right there. This is a little tricky and you'll have to get a feel for it, but there it is right there. and we're going to follow it all the way down. We kind of lose it, but I think it comes here and plugs into the bladder. And we can use this as an opportunity to kind of seamlessly go and look at the bladder. Here we have some hard beam artifact from the hip arthroplasty, so it's a little hard to tell what's going on. But we can take a look at the bladder, we can take a look at the prostate, and take a look at kind of the organs that sit in the pelvis. If it's a female patient, instead of the prostate, you can take a look at the uterus and the ovaries. But here in a male patient, we'll take a look at the prostate, and then actually we can go back to our left kidney, and we can do the same thing. So here's the ureter that's coming out, and there it is right there. It's a little hard to track it, but here we get a little bit better look at this one. It's right there, and there it is, right here. Again, this is something you have to get a feel for, but it's actually coming in to plug into the bladder right there. So I think that's pretty helpful to just run the ureters and just make sure everything looks okay, and then it kind of naturally brings you to the pelvic organs. And we're going to stop here for this part of the search pattern, but now you're in a good position to actually take a look at the GI tract, and actually you can find the rectum here and start running the bowel.